And we're back on Second Street talking about breast cancer, how to detect it, how to fight it, and so forth. Dr. Gordon, I want to ask you, big picture, you're familiar with what Leah went through. You obviously know what's happening across the country when it comes to detecting breast cancer. We hear this message over and over again about the importance of ultrasounds, but it sounds like not enough women are hearing that they may have the type of breast that requires them to, that they should really get an ultrasound too. What do you think needs to change big picture so that Canada can do a better job to detect this disease so that women can start fighting it early rather than giving cancer
Oh,
that head start?
how long do I have to tell you? I mean, honestly, the biggest problem in Canada is a panel called the Canadian Task Force on Preventive Health Care. They're a federally funded
Hmm.
panel funded by the
Hmm.
Ministry of Health through the Public Health Agency of Canada. And they are a panel that makes guidelines for various things, including screening for cancers like breast, prostate, colon, other health issues
Hmm.
like postpartum depression and developmental delay in kids. And this panel that made this breast screening guidelines has no breast cancer experts on it. They are mainly family
Hmm.
doctors and statisticians and nurses and so on. And their guidelines are really bad. And we are working very hard to try to get the task force restructured. But they're the ones who make the guideline that women shouldn't even have a screening mammogram if until they're age 50. That's what they say. That women with dense breasts
Hmm.
don't need any special care. And so a bunch of other women shouldn't do breast self examination, and doctors shouldn't do breast exams during a routine visit. All of those things, which would go a long way to helping us find more cancers early. It's a long story
So
about how
who
they
needs
arrived
to,
at those
let's stop there
guidelines.
for let's stop there. Who can change that, and are they listening?
The problem is that the task force has no accountability structure. They were actually disbanded in 2005 and they were reconstituted in 2010, but they're with
Hmm.
no accountability structure. So nobody gets to weigh in and argue their guidelines. This is a topic that is in big time in front of the Minister of Health right now. I've testified to the House of Commons committee a couple of times, maybe three now, and the problem is, governmentally, it doesn't look good for elected representatives who aren't doctors to overrule a panel of doctors who are supposedly experts. But people are trying
Hmm.
to fix this problem. And in the meantime, the good news is because we are also advocating at the provincial level, and I give huge kudos to the patient advocates from Dense Breasts Canada, that's a nonprofit education and advocacy group. The provinces are now changing their own rules and going against what the task force recommends. The problem is that family doctors trust the task force. They've got to be jack of all trades when it comes to medicine, and they don't have time to do a deep
Hmm.
dive in every aspect, every disease. And so when the task force says, don't screen women till they're 50, if a woman goes to her family doctor and says, you know, I've got a family history of breast cancer. I want to start when I'm 40. If that doctor believes and trusts the task force, they're going to push back and not give that patient the requisition that might have got her a mammogram. If a patient says, I want a screening ultrasound because I'm category D, their GP might say, well, the task force says you don't need any additional tests. And even if the family doctor, like Leah's, was prepared to give her a requisition, depending where she lives, she may not be able to find anybody that will do that screening ultrasound or MRI. And so all those undetected cancers continue to grow and
Hmm.
potentially spread, and they show up at more advanced stages. Now, interestingly, there are two colleagues in Ottawa who've done some amazing research in conjunction with Statistics Canada, and they have now shown the numbers that if you find cancers early, because there's such a huge, the good news is women with advanced cancers are living longer. The bad news is the drugs that are keeping them alive are hugely expensive. The average cost to treat a
Hmm.
stage 1 cancer is about $39,000 per patient, all in. The average cost for a stage 4 patient is about $350,000 per patient. And if they have stage 4 that's HER2 positive, it's over $500,000 per patient. If you use that
Wow.
money to start screening all women in their 40s and doing supplemental screening for women with dense breasts, we'd find so many more cancers early. We'd actually save the country, I think it's around $400 million a year. That's never mind saving the lives and saving the breasts and saving women from having to go through the harsh therapy that Leah's gone through.
Mhm. Yeah, just
We'll
on that
be
note, if
back with
mine had
more
been caught early, I would have like
sorry, Leah,
the
we've
difference.
got to take a commercial break, but when we come back, I want to get your reaction to that. We'll be back in
Perfect.
just a moment.